Hi, everyone. It's my pleasure to connect with you again, but it's my pleasure to introduce Dean Hilary Godwin, who's the Dean of the School of Public Health. And she's really been a leader both on our campus and in our state and in our nation, if not around the world, because of her own research and her own leadership around this moment in time. And 2020 has really been a powerful year for Dean Godwin. A little bit about her background. She did her undergraduate work at the University of Chicago in chemistry. She went to Stanford and got her PhD in chemistry. And then she did a fellowship at Johns Hopkins University. And you'll hear me talk about this in my interview with Hilary, because those are really some of the elite universities in the world. And she went on to join the tenure track in chemistry at Northwestern University, where she was the first woman on the tenure track, and I presume the first woman to get tenure also. So I asked her about that. I asked Dean Godwin to join us in this conversation because her School of Public Health has a range of responsibilities now that are so relevant to 2020, from climate change and impact of smoke from fires to global pandemic, health metrics, racism in the United States, the impact of racism. So many things that are relevant to 2020 right now are all part of Dean Godwin's portfolio. She has been sitting on the incident command team at the University of Washington. So much of the guidance that has led us to make decisions about whether or not we go virtual or whether we can be face-to-face, how we do schooling and how we keep everyone safe. So she's been on the incident command team. She's been on the mayor's COVID-19 task force that brings kind of public health research to the city. And she gets a number of media requests, so speaks to the state and speaks to the nation and speaks to the world, really. So this is a true form of public scholarship. So it is my pleasure to introduce my friend and dear colleague, Dean and Dr. Hilary Godwin.
Hi, my name is Hilary Godwin, and I'm the Dean of the University of Washington School of Public Health. I'm thrilled to join all of you for 2020, the class. My friend and colleague Ed Taylor asked me if I would guest lecture in this class, and of course I was honored to say yes. I wanted to give you a little heads up that I decided to break this presentation into 3 sections, where this little mini intro is the first section. In the second section, I'll provide you with a little bit of an introduction to me and what my experiences have been both as Dean of the School of Public Health here at the University of Washington, and also what my experiences have been in this crazy year of 2020. In the third and final section, I'm going to provide you with some public health basics about COVID-19 that I hope will help you to navigate more safely through the COVID-19 pandemic. I hope you enjoy these recordings, and I really hope that I get to meet you in person someday. Thanks for listening. In this section, I thought I'd tell you a little bit about me and my job, and then how it's been impacted by COVID-19 and the events of this crazy year that we call 2020. One thing that you may be wondering is, what's a dean? Well, deans are kind of like the middle management of academia. Deans have oversight for schools and colleges, and at the UW Seattle campus, we have about 18 of those. As deans, we report to the provost, who's Mark Richards, and through him report up to the president, who's Anna-Mari Kause. And then in turn, the deans have reporting to us the chairs of different departments or directors of different programs that are within our schools. So you may be wondering, So what does that mean that you actually do? Well, it varies a little bit from one place to the next and one school to the next. But basically, deans are in charge of making sure that all the programs are running right, that we're staying fiscally solvent in our schools, and the faculty, staff, and students have everything they need to be able to work productively and to be happy. So what do I do on a daily basis? Well, probably like you, I spend most of my time on Zoom. I have meetings where I talk to people who report to me to find out how they're doing. I help them to troubleshoot any problems that they're having and make sure that if there are things that the people above me need to know about, that I pass that up to them. I also meet with my fellow deans and with the people that I report to, the president and the provost, and other senior leadership at the university, to work together and try and figure out how we can run the university better, how we can deal with problems as they arise, and how we can contribute better to our surrounding community. Another thing you may be wondering is, what exactly is public health? You may have heard about public health more in the last 8 months because of the role that people working in our field have played in the COVID-19 pandemic, particularly around contact tracing and testing. But those are just a small piece of what we do in the field of public health. Public health is really based on the premise that we want to prevent people from getting sick in the first place. Whereas doctors tend to treat people after they're sick and help them to get well, in public health, we try to prevent people from getting sick to begin with. We look at how we can design policies and programs so that people are living under conditions which are more likely to lead to healthy and happy lives. We also look at what are different ways that we can influence people to change their personal behaviors in order to be healthier. And then finally, we also do things like what you've been hearing about with this pandemic, which includes vaccine campaigns, pandemic response, doing surveillance for infectious diseases, and things like that. Those are all part of the public health portfolio. So now you may be wondering, how did you end up getting this job as Dean of the School of Public Health? Well, like pretty much all of my colleagues, I started as a professor. In my case, I actually have a PhD in chemistry. I didn't get a PhD in public health. I actually didn't even know what public health was until I was already a professor. At my first faculty position, which was at Northwestern University, I was actually in a chemistry department. But the research program that I ran there was something that fits really well within the field of public health. I started my career looking at why lead, the heavy metal, is poisonous. And although my research was really focused on trying to understand how lead interacts with proteins and how we can use that information to understand why kids exhibit certain symptoms associated with lead poisoning, I also started interacting with people from the local Department of Public Health and with community-based organizations that were working on preventing lead poisoning. And that was the point at which I had this epiphany that was like, this is what I want to do with my life. So slowly my work shifted more to having a real public health focus. At the same time, I was also taking on some leadership responsibilities. I became chair of the chemistry department at Northwestern University. And after I'd been at Northwestern for 10 years, I had the opportunity to move to UCLA to be a department chair there in the Department of Environmental Health Sciences in the Fielding School of Public Health. So that's what I did. It was a really challenging move, just in the middle of my career to change to a new field and a new institution. A lot of times students ask me, did you have to get another PhD or did you have to, get a new degree? And the answer is no, I was able to use the degree that I had, but it still was a really big change and a big learning curve for me to switch from chemistry to public health. It was really fun though too, because I like being on the steep part of the learning curve. And it was just an opportunity to learn about so many fascinating new things. It also prepared me really well for another change that I made about 12 years after that, which was to come here to the University of Washington to be Dean of our School of Public Health. And I really, really love my job here. We have absolutely fantastic students. They inspire me every day. Our public health students are the people who not just want to change the world, they are going to change the world and for the better. And we're here to help them learn the skills and acquire the knowledge that they need so that they are best suited to being able to do that. I also really love our faculty and staff. They do incredible work, not just in training students, but also in basic research. And public health, we're really dedicated to doing scientific research to build up an evidence base so that we know that when we implement programs, they're actually likely to work. And we, as I said, we don't just work on things like COVID-19 and infectious diseases. We have faculty who work on how can we keep wildfire smoke from impacting people's health in such an adverse way? How can we prevent climate change and the impact that it has on people's health? How can we deal with some of those social determinants of health that impact the way that people live their lives and create health inequities? That includes things like racism, which is prevalent in the United States and has been the impetus for really important social movement that's also been a big part of our year in 2020. It's been a huge honor to work with all these people and to provide leadership for the School of Public Health. I'm just starting my 3rd year here, and it's, despite being dean during the pandemic, it's been an amazing time. Another thing that I really, really enjoyed about being at the University of Washington and being dean here is that I have a really great group of dean colleagues. I'm used to at institution deans sort of squabbling with each other for resources, and it's not really like that here. I find that deans are really interested in working with each other to talk about how we can collectively work to make a bigger impact on the communities around us, how we can collectively work to solve big societal problems, and of course, how to make sure that we're contributing to running our own organization, the University of Washington, in a way that's consistent with our values and that supports the amazing faculty, staff, and students that we have here. It's been just an amazing joy and honestly a very humbling experience. As you can imagine, COVID-19 has had a huge impact on pretty much everything that I do. I mean, it has a huge impact on all of us, on all of our daily lives. But you can imagine working in the field of public health, it's even more so. Within the academic administration at the University of Washington, as has been the case for pretty much every other organization, the last 8 months have really been ones where we've learned how to become agile and respond to ever-changing conditions and to try and quickly figure out new ways to do things and to communicate those out to our stakeholders. And those are things that we've not always been super good at doing at universities. We tend to get sort of stuck in our ways and like the way that we're doing things. And to be honest, the pandemic just doesn't allow for that. We've learned how to change really quickly. For instance, we were the first university in the United States to shift to having classes online in response to the pandemic. The pandemic has also resulted in a big shift in how I spend my time these days. I spend a lot of time helping the people in my unit and my co-leaders across the institution to figure out how to respond to the new challenges that COVID brings us pretty much every week. And to try and translate what we're hearing from public health agencies and what we can reasonably expect going forward. As part of that, I've been serving on the University of Washington COVID-19 Incident Command Team. We meet every Monday, Wednesday, and Friday at 8 a.m. by phone. So you can think of it as sort of like as though I added a new class to my schedule. That's just about how we at UW respond to COVID. The COVID Incident Command Team, it's just an amazing group of people from all across the university in different arenas. And what brings us together is this, this shared vision that we want to make decisions that are based upon our values and that are best for our entire community, including the most vulnerable members of our community. It's been just a huge honor to work with that group, and I've learned a tremendous amount. But as you can imagine, it is pretty time consuming. Another big change that's come with the pandemic for me personally is that the mayor of Seattle, Jenny Durkin, asked me to serve on her COVID-19 task force. Again, it's just this incredible group of people and a tremendous opportunity to learn about how decisions are made in our city and to be able to bring a public health perspective to that decision making. That task force meets with the mayor once a week, and we meet with her team additionally another once or twice a week to plan for those meetings with the mayor because we want to make the best use of her time. That too is it's like adding another class, but I feel like it's a really valuable use of my time. obviously incredible to be able to provide that kind of service to our surrounding community. Another really big change that the pandemic has brought is that I get a lot of requests from the press or the media to do interviews and talk about what the evidence base is that's been built up around COVID-19. And again, that's a big part of what we do in public health. We're trying to build up knowledge so that we can make informed decisions. And so I get questions about, what do we know? What do we not know? Why did things change? What can we reasonably predict might happen in the future? How can we deal with the huge uncertainty that we face? And then finally, as I mentioned earlier, this year has also seen the emergence of a new social justice movement. And social justice is really important to us in the field of public health. It's not just because social inequities lead to health inequities, and they definitely do. It's also because public health is based on core values of health and justice for all. So in public health, we've been very supportive of the social justice movement and really thrilled with the hope that it brings. We've also used it as an opportunity to look deeply at our own practices and how we run our own organization to see where we might not be doing everything that we could be doing, and then to work to try and change those practices. So all in all, 2020 has been a super busy year for me, as I'm sure it has been for you. And I have no doubt that it's going to bring even more surprises before it ends. Many of the changes, like the pandemic, have not been happy ones for any of us. We've seen people that we care about get sick, struggle economically, and in the worst cases, die. However, the current social justice movement gives me hope. I draw a huge amount of hope from our tremendous students, both within the School of Public Health and across the university. And cherish the hope that they have and the faith that they have that the work that we do today will lead to a stronger future. I'd like to talk to you today about some public health basics about COVID-19 that'll hopefully allow you to navigate the pandemic a little bit more safely. First, I wanted to share some useful resources and references. The first URL that I have listed is for the University of Washington COVID dashboard. That's where you can check to see how many cases have been reported on our campus recently. The second is a link to the University of Washington COVID homepage. I've also provided links to the homepages for COVID resources from a couple of different public health agencies. The first is our local health department, Public Health Seattle and King County. The second is Washington's Department of Health's COVID-19 page. The third is the U.S. Centers for Disease Control and Prevention's COVID landing page. And the last one is for the World Health Organization's page. If you have more questions after you finish watching this, or just have questions later on, these are all great places to check for answers. It has escaped none of our attention that we are in the middle of what is truly an unprecedented pandemic. This is an example of the kind of information that you can find on the World Health Organization's site, which shows cases worldwide. At the time of this recording, which is October 4th, 2020, more than 34 million cases of COVID-19 had been reported worldwide, and more than 1 million deaths. In the United States alone, we've had more than 7.4 million cases reported and over 209,000 deaths. In our own state of Washington, at this point in time, we've had close to 90,000 cases reported, and about a quarter of those have been in our own King County. On the bottom part of this screen, you can see a graphic that shows you, it gives you a sense of the number of cases that we've experienced every day so far during this pandemic. And you can see that in the last couple of months, we've had a lot of dark red boxes. Those are days where there have been more than 500 cases reported each day here in the state of Washington. And you can see that we're still in a pretty active part of this first wave of the pandemic. We're doing a lot better here in Washington than in many other regions of the United States, but we'd like to keep it that way. So it's really important that people adhere to local ordinances that help to keep us safe and healthy. So I'm going to tell you about some of those. I also think it's worth talking about what the attributes are of COVID-19 that have made this particular virus so deadly and difficult to contain. The first of these is that this is really a new virus. We've had other coronaviruses circulating for a long time. What we refer to as the common cold, actually one of the major contributors to that is a coronavirus. But those are different types of coronaviruses. COVID-19 is a brand new one that we haven't seen before. And that means that we don't have a vaccine for it. And it takes a while to create that vaccine. First, we have to go through the development process, and then we have to go through clinical trials that are designed to test whether or not it works and whether or not it's safe. Even once a vaccine has gone through all that phase 3 testing, we still need to, and we're confident that it actually works and that it's safe, we still need to ramp up production, and that takes many months. And then we have to actually get it distributed out to hundreds of millions of people across the United States. Right now, our best estimate is that we won't reach that state where we have broadly distributed vaccine that is available to pretty much anybody who wants it in the United States for probably at least another year. So that means that we're still really reliant upon what we call social distancing or non-pharmaceutical interventions. We're also working on trying to develop effective ways to treat coronavirus, but so far we haven't found anything that's really a magic bullet. The best things that we found so far are good at relieving symptoms for people who are really sick and reducing the risk of death and the length of their hospital stay, but nothing that just completely stops the virus in its tracks. In addition, because it's a new virus, we didn't have tests available when the virus first emerged. And those tests take a while to develop. Here in the United States, we missed some valuable time at the early phases of the pandemic because initially the only tests that were available were at the Centers for Disease Control and Prevention in Atlanta. And that meant that the virus started circulating and spreading in the United States in many different locations before we were able to start testing and controlling it. Today, we do actually have pretty good tests available, but we're still kind of limited in how many tests we can perform at any given time. So that still constrains our ability to control the virus. And I'll talk about that a little bit more on the next slide. The next thing that has made COVID-19 really difficult to contain is that a large percentage of the people who get COVID-19 have very mild symptoms or moderate symptoms, or even no symptoms at all. We call those people who have no symptoms asymptomatic. While that's great if you're the person who happens to be asymptomatic, it's really challenging for us in the public health field because you don't have a sign that you might be infected. And in the meantime, you can still be spreading the virus to other people. That means that we don't know that you should be isolating and staying home, or even that you should be getting tested. And so that makes it really challenging for us to contain the virus and keep it from spreading even further. The flip side of that statistic also creates challenges. So the 20% of people who have severe symptoms, of those 20%, a pretty high percentage require really intensive treatment or hospitalization. That's much higher than, that number is much higher than what we see for seasonal flu or the common cold. And that high percentage of people that need really intensive medical care puts a big strain on our healthcare system. That's a problem for a couple of reasons. One reason is that when we strain our healthcare system, then we can't provide really high quality care for everyone who needs it. And that means that some people who would fare better if they had intensive treatment might not get access to it and might not have the best outcome that they could. It also means that we have difficulty providing routine health care to individuals or to individuals who have emergency situations that are unrelated to COVID-19. So what we've seen during this pandemic is an increase in deaths in the United States that are not due to COVID-19, that are just due to people's difficulty in getting access to care or receiving routine medical treatment. I'd like to talk a little bit about the kind of tests that we now have available. So the good news is that we have a lot more testing available now, particularly here in Washington. We have a great laboratory both at the Public Health Lab and also the University of Washington Virology Lab. And we also have access to testing through the Seattle flu study. However, there are still limitations to those tests, and I want to talk about those. There are two big categories of tests. Tests for telling us whether or not someone currently is infected, and tests for telling us whether or not someone's been infected in the past. In the case of the tests that are whether or not someone is currently infected, the most sensitive type of tests are PCR-based tests. And those are the standard that you usually hear about. The PCR-based tests are great because they're very sensitive, but even with the level of sensitivity that they have, it can take several days and sometimes up to 2 weeks for someone who's been exposed to COVID-19 to build up enough virus in their body to turn up positive on a PCR-based test. So that's one big limitation. And it's a reason why we tell people that if you know you've been exposed to COVID-19 or you think you likely have been exposed to COVID-19, you need to quarantine yourself for that full 14 days and not interact with other people. Even if you get a negative test early on, it means that you need to get retested throughout those 14 days and stay away from other people during that time. The other type of test for whether or not you are currently experiencing a COVID-19 infection is an antigen-based test. These tests are faster, they're cheaper, but they're also less sensitive. So the same kind of limitations that we talked about for the PCR-based tests also apply for the antigen-based tests. We also have tests that tell us whether or not your body has built up an immune response as a result of having been infected with COVID-19. These are called antibody-based tests. So they basically tell you whether you're either previously had an infection or you're so far along in your current infection that you've already built up an immune response. These kind of tests are really helpful for us as public health professionals because they give us a better sense of how many people have been infected with COVID-19 over time. And that's great because from the other type of tests, we'll often miss a lot of people, those people who are asymptomatic and just never got it tested in the first place. However, the antibody-based tests are not really helpful for you as an individual in terms of determining what you should do next. And the reason for that is that we still don't know whether or not having been infected with COVID-19 once provides you with any protection from getting reinfected. So just because you have a positive antibody-based test or a positive PCR or antigen test doesn't mean that you can't get sick from COVID another time. That means that regardless of whether or not you have a positive test in any of these categories, you still need to be careful and make sure that you're not getting exposed to people who have COVID-19 and taking the kinds of precautions that we're going to talk about in a few minutes. So how has COVID-19 spread? Again, we've learned a lot about this as our knowledge about this specific coronavirus has improved. What we now know is that the main route for spread of COVID-19 is through droplets that contain the virus. Those droplets are released from someone who's infected when they breathe or when they're speaking, and a lot get released if they yell or they're singing or some type of activity like that. Another person then gets infected when they breathe in those droplets through their nose or mouth and they land in the lungs. So what we do know is that those droplets can stay in the air for at least 6 feet, but then they start to sort of fall out of the air by gravity. And so that's the reason that we ask people to try and stay 6 feet apart. It's also the reason that we ask people to wear face masks. Wearing a face mask, if you're infected, traps the virus, so you're not spreading it to other people. And if you're the person who's wearing the face mask and other people are infected, it also means that you're protected from some of those droplets getting into your respiratory system. Early on in the pandemic, we were worried more about another route, which is a common way that flu is spread, which is that the droplets fall onto surfaces or objects, and then by touching them and touching our nose and mouth, that you can get infected. That is a possible route for COVID-19, which is why you see us doing cleaning activities and encouraging people to wash their hands, but it's not the main route of exposure. So that's why lately we focus much more on face coverings and maintaining distance and not being in crowded spaces indoors. So here are the measures that we know reduce the risk of transmission of COVID-19. The first one that's really important is that if you feel sick, you have experienced symptoms that are related to COVID-19 or any other respiratory pathogen, please stay home. This reduces the chance of you transmitting to people. Even if you ended up having the flu, we'd rather not have that spread, because the more disease that's being transmitted, the more complex it's going to be for us tracking down COVID cases and controlling them. In addition, it's really important to stay 6 feet apart from people, particularly when you're in enclosed spaces, but even when you're outdoors, so that you're not within that range where you could be breathing in their droplets. If you have been exposed to someone that you know has COVID-19 or later found out has COVID-19, it's important that you self-quarantine for 14 days. In addition, it's really important to wear face coverings, and those can even be cloth face coverings. Anytime that you're going to be around people who aren't people that you live with all the time. So not your immediate family members or roommates that you live with. And that's both when you're going to be around people indoors at any distance or outdoors within 6 feet. And then finally, we also talked about the cleaning of surfaces. So what are the most important things for you to do? The first one is make sure that you wear a face covering. That's really important. You should be doing that anytime you're interacting with other people, indoors or out. You also want to stay 6 feet apart from people. Again, whether you're inside or outside. And it's not an either or. It's not, I just need to cover my face because I know that we're going to be within 6 feet. You should be doing both of these things, particularly indoors. And then the final thing is to really pay attention to avoiding crowds and gatherings. This isn't just the big crowds like what I showed here, but also any gathering where you have more than just a couple people, particularly people who you're not living with, increases the risk of spread of COVID-19. We know this is a hard one. It's really hard for young adults who love being with other young adults. It's hard for all of us. This is part of being human, is that we love to socialize. But it's really important in terms of limiting the risk of transmission and limiting the risk of what we call super spreader events, where you have a large number of people interacting and the potential for a large number of people getting infected at the same time. The next thing that you can do is to sign up for the Husky coronavirus testing program. This is run by the Seattle Flu Study, which is a great local research initiative. If you sign up for the Husky coronavirus testing program, you'll get a daily query by email asking you to check whether or not you have symptoms, and also asking you whether or not you've engaged in any high-risk activities like being in close proximity to other people or gathering in who have COVID-19 or gathering in crowds. You'll also get access to free testing. This is a completely voluntary program, but it's really important in terms of allowing us to keep tabs on whether or not we're having a surge in cases, and also allowing us to get in touch with people who have who test positive and find out who they've been in contact with and contact those people so that they can self-quarantine until we're sure that they're not sick themselves. Finally, I just wanted to say, I know this is really challenging. This is a really difficult time for all of us in so many different ways. But together, we can work by creating this network of different protections to keep each other healthy. And with that, stay healthy, Huskies.
I'd like to thank you, Dean Hilary Godwin, for joining us. I'm so grateful that you were a part of our class. You said such important things in your talk, and I want to ask about some things that you didn't talk about in your talk. You're the Dean of the School of Public Health, and your background is so interesting. You went to, as an undergrad, the University of Chicago, and you studied chemistry. You went to Stanford, where you did your PhD in chemistry. And you went to Johns Hopkins, where you did a fellowship there. Those are really some of the elite universities in the country, by the way. So go back to a young Hilary Godwin, and you're going to the University of Chicago, and you decide to study chemistry. How did you get there, and what inspired you to be a young female scientist in your youth?
Yeah. Well, first of all, thanks, Ed, for inviting me to participate in the class. I'm very honored to be here, and it's a pleasure. Yeah, so young Hilary, my parents would tell you I was very indecisive as an undergraduate. They used to joke about my major of the month. And I went to college thinking that I wanted to major in either cultural anthropology or clinical psychology, neither of which were majors at the University of Chicago, and took an introductory sociology social science sequence during my freshman year, which was way over my head as an 18-year-old, and realized very quickly that the way that anthropology was taught, at least at the University of Chicago at that time period, did not resonate with me. Then I switched to maybe majoring in biology and looked at that for a while. And then and people always are like, I can't believe this is true. I loved my first quarter organic chemistry class, which is not a very common thing for people to say. And my TA said, you should do undergraduate research. So I started doing undergraduate research in one of the labs and totally loved it. And so it was really just this oh, this is the right thing for me. And that was why I ended up majoring in chemistry.
That's great. And then Stanford for the PhD, still in chemistry.
Yeah, I mean, at that point in my life, I call myself a reformed chemist now. At that point in my life, I was all in with the chemistry, and yeah, I went to Stanford to get my PhD, and got a PhD in physical chemistry, and at the time really loved what I was doing. But by the time I finished my PhD, I started having this feeling of what I was doing was pretty esoteric, and wanting to do something that had more of a direct impact on people and their lives, and also missed the interacting with people. Mm-hmm. And so that was why I ended up doing the postdoctoral fellowship that I did at Johns Hopkins in the School of Medicine. I shifted pretty much to what was much more a biochemistry topic. And then from there shifted even more so into studying why lead is poisonous.
So then you made your way to a tenure track appointment at Northwestern. And I learned just by looking at your background that you became the first woman in chemistry at Northwestern on the tenure track. What was that like?
It was hard. So I come from a I come from a family. Sometimes they seem like a faculty of a family of scientists. So I have four parents because my biological parents split up and remarried, and all four of them are professors of biology. So it was sort of this foregone conclusion of like, she's going to be, a university professor and a scientist. But I really, when I got to Northwestern, had very much a sort of crisis of confidence, being the only woman there. It felt like a big weight to be carrying. That I felt like people's expectations for whether or not I was successful and that I was sort of carrying half of humanity, and they're, along with me. It was hard. I'm not going to sugarcoat it. It was hard. On the other hand, some parts of it were fabulous. I was so young at the time when I started. I think I was 29. And as an assistant professor, you you have to teach, which I love doing. But otherwise, in terms of research, they're like, here's some money, here's a lab, go do whatever you want to do. And I loved being my own boss. And it was a time of discovery. That was wonderful.
You had what you call an epiphany at UCLA. You were a chemist for the most part, studying lead poisoning and the impact on children, which is so important at the time. And then you made an intellectual and professional shift from chemistry to public health. What prompted that shift? And tell me why it was so hard for you, because you mentioned it was hard.
Yeah. So it was twofold. So one was the intellectual part of the shift. The intellectual part of the shift was that as I started working on lead poisoning, I started realizing that I could study this problem in excruciating minutia, and it still wouldn't prevent any kids from getting lead poisoning. And for me, that was sort of the first hint of the inner public health person of like, I'd rather this problem didn't happen in the first place as opposed to us understanding why it happened later on. So that was part of it, and starting to work with Chicago Department of Public Health and community-based organizations on primary prevention of lead poisoning. And so that was a big part of it, was just loving that and loving that approach and the public health approach. The other part of it was more personal. Right after I got tenure and right after I had, I have one child, but right after I had my child, I was diagnosed with cancer. And and I didn't have a great, obviously I'm fine because I'm still here, but I didn't have a great prognosis at that time. And one doctor said, you have maybe 3 years to live, and at age 34. So it was kind of harsh news to get at the time. And it really caused me to reassess like what I wanted to do, what my priorities were, what was my place in the world, and allowed me to have a sense of freedom to pursue something that I was really passionate about, even if it wasn't what other people expected or what I had been trained to do. So it was somewhat freeing. So it was sort of on the tail of a couple of years past that when I realized, hey, I'm going to be here for a while on this planet. Woohoo! And so make the most of it.
So many of our students feel pressure to know what they want to do at all levels of the system and to commit to something and to stay with something. Yours is a story of all kinds of transitions and transformations. Let's come to now. It's 2020. You're the dean of the School of Public Health, and among the things that your school focuses on, wildfires and the impact of smoke, climate change, racism in the United States, and pandemics, and the health metrics, health in our nation, our state, in our world. And here it is 2020, and all of these things are kind of centered and featured. How do you manage that scale of the range of issues as a dean of a college that's dealing with so many issues at this moment in time. What's 2020 meant for your college for this year?
Yeah, I mean, this is one of the reasons that I love public health is that it does cover all these different topics. I, I love learning about new things, and there's always something new to learn about. For sure, as a dean of a school of public health, I'm not like the expert in everything public health. I'm constantly learning from the faculty and the students who are in the school. And it's been an opportunity to highlight some of the fantastic work that people here are doing, and also to share some of the perspectives that we have, and to have a voice, an opportunity to talk about the deeper reasons why we're going through what we're going through and what we might do to make things better in the future.
Let's get to some of those deeper reasons. So let's think about the last 8 months. We're the first public research university in the country to move to online. And that happened largely with your guidance. It's not just the technical part of it, but the rationale for doing it. And you mentioned in your video, in your talk, that your weeks are busy. You are 3 days a week, you're on the COVID incident command team. You're on the mayor's COVID-19 task force. And you have regular media and press requests that take your voice and your work and your knowledge around the state and around the nation, around the world. Let's start with the COVID incident command team that meets 3 days a week. Take us inside the room. What are you doing in a command room, and what kinds of things are you talking about?
Yeah, so it's a virtual command room because we're usually on the phone, so we're all in our different places. But it's this amazing group of people from, Denzil Suite representing student life to the head of our buildings and maintenance to the person who's in charge of our medical systems response, and really trying to sort of integrate all of those different perspectives into an approach to decision making that's holistic, and values based. It's an amazing group. It's a very democratic process in terms of people get to say like, hey, from my little corner over here, this is what that response looks like. But we also have an amazing leader, Margaret Shepard, who runs the meetings, who just keeps us on task. And so, yeah, what's a good example of something that we deal with?
Well, let me ask.
Yeah, go ahead.
It seems like many people around the state, if not around the nation, were watching to see which colleges are going to go back in person and which were going to be virtual. And a lot of people were watching and seeing, how's that decision going to be made? I presume that's one of the decisions that you were discussing and having to decide and advise the president and the provost on in that committee, that incident command. Is that part of what you were doing?
Yeah, absolutely. So both the big picture decision of what is the fall going to look like, but also the timeline of which decisions need to be made at what time, so that students and their families could get prepared and understand what's going on and arrange their lives, so that faculty could do that, so that we could have buildings ready, that the facilities were ready to go. From all those different perspectives. And then also just walking through there's so many things that can change in a period of a couple of months. So between when we make a decision and when we start school, what are all the different things that might happen that we're going to need to respond to, and sort of trying to be ahead of the curve and anticipating those.
You take us to some data and you link us to resources. And let me just repeat some of the data that you highlighted. 34 million cases around the world, 1 million deaths or more, 7.4 million cases in the United States, 209,000 deaths, 90,000 cases in the state of Washington, a quarter of those in King County, where many of us live. put in context what those numbers mean, the impact and the scope of those numbers? What do they mean when you hear numbers like that and when you report numbers like that?
Yeah, I mean, on one level, I think what all of us have experienced is that the numbers are large enough that we all know someone who's been deeply impacted by COVID. Even those of us who have been fortunate not to have loved, an immediate friend or family member, certainly have friends and family members who have lost someone. So that's part of it. And that has to do with, when you look at the 209,000 deaths so far, that's in the context of every year in the United States, we have about 2.8 million deaths. So given that this is about 2/3 of the way through the year, 2/3 of the year that we had the pandemic, or 3/4 of the year, that's about 10% increase in deaths over the background level. And we're also seeing an increase in background level deaths in the United States due to people not getting appropriate care for things other than COVID. So yeah, it's not an inconsequential blip. It's a really significant impact in terms of deaths. And as horrible as the deaths are, then there's just the extensive impact in terms of everyone's daily lives that this pandemic has brought.
I couldn't help but to hear you say the words that got my attention. You said the first wave of the pandemic. Is there another wave coming?
Well, we don't know. It's hard to predict the future. But I think, what we do know is that it's going to be a while until we have either a vaccine that's widely available and that enough people have had taken in order to see some impact in terms of immunity on the general population that would change the way that we manage the disease. And so that means that as long as we're in this situation where the majority of the population is still vulnerable to COVID and we don't have some other kind of protection, that we're still going to be dependent upon the kind of measures that we're using right now. And so basically that means we will release some of those restrictions because they're really challenging for us as a society. And then we will see the levels increase. And then we may have to, increase the restrictions and see the levels go down. And so we're going to be playing that sort of titration. And unfortunately, we can have situations like we've seen so far where enough cases develop that we get a surge. And that's sort of a new wave. So yeah, it's very possible. We're also, also concerned about going into colder weather, people being indoors and not being able to gather outdoors, that could increase spread. And of course, worried about how seasonal flu, which is coming up, is going to impact people's health and spread of disease as well.
So Dean Godwin, you described the distinction between schools of public health and, say, schools of medicine, that schools of public health aim to prevent illness and prevent disease. And physicians, in many cases, treat diseases. In light of the data that you provide on the number of deaths related to COVID and the number of people who've been sick, could we have prevented some of these illnesses? Could we have prevented some deaths?
Yeah, so I'll start with sort of the good news. The good news is we actually did do a lot of prevention work and continue to do prevention work. So the good news is that because we had seen a couple of emerging infectious diseases in the last decade or so, including some flu strains that threatened to become pandemic, that we had done a lot of preparedness as a country and locally around that. And so we had really good pandemic flu preparedness planning. And if you look at why we as a university have done relatively well and why Washington State and King County have done well, is we really followed those planning guidelines. So we as a school immediately jumped into following our pandemic flu preparedness, as did the county and the state. So that helped a lot. And we continue to use prevention measures in terms of contact, following up with people who test positive and doing contact tracing and calling the people who've been likely infected and asking them to quarantine and isolate. So those are all good prevention measures that we are using to help decrease the number of people who get sick and the number of people who die. The could we have done better is a great question. I think, we can look to those countries that have done better and reasonably say, yeah, we could have done better. A great example is South Korea has done super well. They had recently experienced an outbreak of an infectious disease. And so we're really sensitized to the importance of getting out tests quickly, and also really taking seriously consistent communication about how to contain the disease. And the population was more responsive to that because they had seen an outbreak recently. And they have done a lot better. So yeah, I think you could reasonably argue that in the United States, had we been better coordinated on a national level, had we been more consistent in our messaging, had we had a more rapid response in terms of testing, that yeah, we probably could have prevented a number of cases and deaths associated with COVID.
The common cold is a coronavirus, and COVID-19 is a new virus. And do we know still where it came from, how it got to the United States?
Yeah, so some of this is kind of like detective work, and we don't know with 100% certainty, but what we do know is that many new infectious diseases that we see, including this coronavirus, COVID-19, appear to come into the human population, transferring from animal populations. And we believe that's the case for this one as well. We believe that happened in China, which is where the first cases were seen. And then we saw a spread around the world as a result of global travel.
And you said that we didn't have tests available in the country, and that cost us some time. Why didn't we have tests available?
Yes, so I talked a little bit about PCR-based tests, and without getting super duper technical, you need to know the genetic sequence of the virus in order to be able to have a PCR-based test. And then you also need to do some important lab work to test to make sure that you only pick up this specific coronavirus and not the common cold coronavirus or other viruses. And doing that kind of development and validation takes time. In the United States, we have pretty strict standards for that, particularly for what are called diagnostics, which this is a diagnostic test. And so that slowed our development of it. Also initially, as part of that, all testing needed to be conducted at the Centers for Disease Control and Prevention. And the initial test that was developed had some problems in terms of responding appropriately and not giving false positives or false negatives. So that cost us some time and meant that those few cases that came over through airplane travel sort of got established in populations and spread before we were looking for them. And now that we know there's a lot of asymptomatic people, we're pretty confident that there was a lot of spreading before we started doing widespread testing.
Should that make us nervous that there are a number of asymptomatic people out there, or that I may have had a PCR-based test tested negative initially, but we don't really know the result of that test for upwards of a week or 2 weeks? How do people manage? How do we manage through our day knowing that we might be exposed? We aren't really sure, but it's kind of a cautionary tale. What do you say to people that are kind of unsure?
Yeah, it's a hard situation because on the one hand, it doesn't help to have people be scared and frightened. Um, so I do agree with when people say like it's not helpful to cause panic. We don't want to cause panic, and we are fortunate that a large number of people are asymptomatic in terms of them doing well. But it makes it really challenging to control. And so that's why we have resorted to asking people to minimize the number of people that they interact with, so that if they do end up being positive, that they won't have infected a lot of people, and we can track those people down using contact tracing, and then ask them to quarantine or isolate, so that they don't further spread it. Those are the prevention measures that we have available to us. They don't seem very sophisticated because they're not, but that's all we have right now, right? So, yeah.
One of my favorite things about you, there are many, Dean Godwin, but it's the way that you talk about these things. And there's a part of your talk that is, I think it's just beautiful because it's just so clear. And I've seen you talk to top researchers in the world. And I've also seen you translate this so that you could be talking to a fifth grader. And I've been on phone calls with you talking to public school people about the kinds of things that we need to do to get kids, first graders, back at school again. And so you went through and you talked about face covering, staying 6 feet apart, avoiding crowds, limiting super spreader events. And you lay out the research and you lay out good practice in such a thoughtful way. So I just want to thank you for that and for making such sense and how important that is to our region and to our state and our nation. As you say that, though, it's hard not to ask the question, as we ask students and we ask our community and even ask kids in schools to practice the very things that you laid out. And one can turn on the television and see some of our leaders nationally. You see the spread of COVID among elected officials. How do we make sense of that paradox? What is that? How does someone in your role make sense of the importance of saying one thing and then in some cases, leaders, and I'm not talking about particular leaders, any of us, not modeling the very thing that we're preaching? How do you make sense of the kind of noise in the air and pull the signal from the noise?
Yeah, it's been very challenging for us. I think this is one of the things that has most complicated our ability in the United States to get people on board, is that we haven't had consistent messaging. And one of the things that I love about being not just at the UW, but also in Seattle and King County and Washington State, is that we have had leadership at all levels who have been very consistent about relying upon the evidence base that we have from public health and consistently messaging around it. And I guess what I would say to them is, you know, we're a pretty science nerdy kind of institution. We love the humanities as well, but we have some world-class scientists, and we do have good evidence to support that those measures, namely wearing face covering, staying 6 feet apart, and not being in big gatherings, isolating if you've been exposed, those do work. And so we're asking Huskies to go with the science, be leaders by example, and do the right thing.
Judging from your talk, we're going to be in this for a while. Vaccine or no vaccine, we're going to be in this for a while. So what's your vision for when we get back to whatever constitutes normal? Tell us about what we can look forward to.
Well, so I kind of think this is going to be one of those situations where we don't go back to the way we were before, that we define a new normal. Hopefully the new normal is better than where we are right now. Hopefully the new normal involves more interpersonal socialization, because it's so important to us as human beings to do that. I guess I also hope that the new normal is one in which the lessons that we've gotten from this pandemic around health inequities and around social factors like racism impacting adversely how people experience things like the pandemic and experience life and their opportunities to be healthy, that we we have a renewed awakening around those issues and a renewed commitment to working on those issues. That to me could be a silver lining of the pandemic in the long run.
You use the term network of protections. Describe a network of protections? It sounds like a
Yeah.
network. What
Yeah. So the idea is each one of these protections is not 100% effective, right? So this is where we sort of got into trouble in the beginning of the pandemic when we're like, well, face covering isn't 100% effective, because we were used to having really good controls for infectious diseases, because we were in a position in history where we were incredibly privileged to have antibiotics, antivirals, vaccines, and this virus isn't like that. So we're having to make do with interventions that are not 100% guaranteed. But the idea is that the face covering may have some holes in it, and not literally, but it may not be 100% effective. Let's say it's 70, 80% effective, but you put on top of that you're socially distancing, and on top of that you're avoiding crowds, and then on top of that you're isolating if you think you've been exposed. And through the combination of those measures that we can really slow down spread of the disease and offer some level of security to people.
My final question to you, Dean Godwin, is this, and this is, I have firsthand evidence of this. You have a reputation of being the happiest administrator, the happiest dean of all the deans. And in light of all that you just talked about, global pandemic, racism in America, smoke from fires, climate change, all of that you carry as part of your role and responsibility, and you know the truth about all of that. What makes you so happy? And what advice do you have for those of us looking at modeling through this pandemic? What advice do you have for our students and for our community to feel some joy in all of this? What makes you happy? How do we experience joy in the end?
Yeah, it's a great question, Ed. I mean, part of it is personality. And I also want to say too, like, I'm not always happy and positive. Just so that people don't get the wrong opinion. I mean, and there have absolutely been times in the last 8 months where I've woken up and I was like, I just need to go back to bed today, because some days are just really hard. And I think, life is like that. We all have experienced different periods in our own lives when things are more challenging than others. And this is one where it's just collectively extraordinarily challenging for almost everybody. And so there is no happy pill to get past that. Some of the strategies that I find helpful are, I do actually really focus on getting a good night's sleep every single night. And I will forego things that I love to do, like checking out the news late at night. I just don't do that, because then I won't sleep. So I often say sleep is my religion, but getting a good night's sleep helps a lot. And then the other thing is, and again, this sort of comes back to these lessons learned from life's tragedies of really in times of despair and when things are really hard, going back to the basics of the things that I care about the most, which for me is for sure my family. So, if I'm having a really bad day, literally I'll come off of COVID incident command and say to my husband, will you go for a walk around the neighborhood with me? And sometimes that, I said there one day, I was like, that was the best part of my day. And he was like, I know. So, it's I try to find the joy where I can. And I am privileged and honored to have a job where I feel like I can make a difference. That also is something that I think many people find gets them through difficult things.
Well, I will join you and many leaders and our students in our community toward a healthier community, and hope that we will all sleep well. Dean Godwin, thank you so much for your talk.
Thank you. And thank you for doing this class.
Yes.
Amazing.
Take good care.